Hi guys, this is Dr. Meena and you're watching Health and Wellbeing with Dr. Meena. Our topic today is shingles. What is shingles? What causes shingles? What symptoms you have and how can you prevent it? So let's get started. What is shingles? Shingle is a viral infection of chickenpox virus. It is in your body from the time you get chickenpox. So as children, when you get chickenpox, the virus stays in your nerve root and it flares up later on in your life and cause a different kind of disease, not chickenpox, but shingles. So what causes shingles? There are many reasons that you can have a flare-up of shingles. Shingles, chickenpox virus can stay in your body for 10, 15, 20, 30 years and you'll have no symptoms. Some people live all their life have no symptoms, but sometimes it flares up. What makes it flares up is you get physical or emotional stress. Physical stress can be cold, cough, fever, pain, and emotional stress can be exams, death of a loved one, divorce, wedding, birthday, planning. Any of these events can bring in shingle flare-up. So where does shingle stays when you have chickenpox? Let me explain it to you with this graph. So what happens is when you have chickenpox, so these are your vertebral bodies, your spine, and the nerves coming out, they come around from your chest up to your chest wall in the front. So there is a small nodule or ganglion present at the beginning of the nerve. And when you get chickenpox, some virus get embedded there and lives over there. And under the conditions I told you, it flares up. So what happens when you get flare-up? When you get flare-up, it starts with the pain and then with the rash. So what happens is along this nerve root, like a patch, with this patch coming from back all the way to the front where the nerve is going, you will get pain, which is excruciating pain because this is inflammation and infection of a virus happening along the nerve, and nerve pain is very severe. So you get pain and you get a rash. Rash is bubbles, water-filled, fluid-filled kind of bubbles. And they can be in groups. So you can have 3, 4 here, 3, 4 here, 3, 4 there. But you know, like a patch coming in front from the back here, it can be in your face, it can be in your legs along one nerve roots. You don't need to know the nerve roots, but you'll see in a pattern going straight in a same line. So if it is along here, it can be in small patches, or it can be a whole, patch going like this all along is a rash. You can get it in young age also, shingles. I've seen 20 years old patients, I've seen 30, 40. It causes a couple of rashes and hardly any pain and people get better. But if you are 60 or above, this causes severe, severe pain. And severe pain can last anywhere from few days, few weeks to up to 3 years. And this is called herpetic post-neuralgia. And that is the rash has inflamed the nerve on that route and there is excruciating pain. So if you along the nerve get pain and then you start seeing a rash, go and see your healthcare provider immediately. There are medications that can be given that can stop the multiplication of the virus. So virus starts with small few patches. Over days it gets worse and then worse. In few days to weeks it starts dying down. So you can stop the multiplication at the beginning and that will not cause such a severe pain. You cannot get rid of the virus, but you can stop the multiplication and then stop the disease process from going further. Secondly, if you take care of it early, it can prevent the pain and the severe inflammation of the nerve root. So see your healthcare provider if you said get the nerve root pain, along one or on the face, you get rashes here or here and they're very painful. Sometimes they're itchy, but mostly they're painful. On the head, this side of the head going all the way to the scalp. These are all shingle rashes and they cause pain and rash. Now, how can you prevent shingles? When kids are born, they're given a chickenpox vaccine. If you give your child a chickenpox vaccine, that will prevent them from getting chickenpox and that virus living in the nerve and later on causing shingles. So getting your kids vaccinated for chickenpox is important. So when they grow up, they will be thankful they didn't get the shingles. Secondly, you're in middle age and elderly, you did have chickenpox, and now what to do? There are shingle vaccines available. Taking those shingle vaccines can protect you from getting shingles. Remember, in medicine, there's nothing 100%. It is always 70, 80, 90%. There's never black and white in medicine. It is certain percentage. Few people can get shingles after the vaccine. Few can get second time shingles. It's unlikely, but it can happen. If somebody has shingles, please don't worry. You're not going to get shingles from them because they got shingles from the childhood virus that was living in their body. The only way you can get from somebody and you can develop chickenpox from that shingle virus is if your immunity is low. You're on cancer treatment, or you have kidney failure in your dialysis, or you're a transplant patient, severe heart failure. All these things decrease your immunity, and a person who has shingles can pass that virus to you and you can get chickenpox. So it is important that people who are immunocompromised should stay away from people with shingles. Otherwise, if you're a healthy young adult or even an older healthy adult, that means you don't have to worry about getting shingles from somebody else. I hope this is helpful, and we always recommend getting vaccination to prevent diseases and stay healthy. So I hope this is helpful. Don't forget to subscribe my channel and also click on the bell icon so you can get notification of all the new videos that are coming in. See you. Bye.